placing our hands here. We'll start with some alternating compression. And then as you do alternating compression, you start to linger a little bit longer with each compression. The wider you go, the bigger movement you get. So I go out wide. But if I'm more centered in the neck, then the energy just transfers down to the core a little bit. And then we're going to do a few release points. So we're going to feel for a couple of points on the top of the shoulder. One is Gallbladder 21, which if you look at the space between the lateral border of your neck and the acromion on the highest portion of the upper trapezius, feel on yourself. You press down and you feel like a lump there, sort of like another head is starting to grow out the top of your shoulder sometimes. Yes? And this is a very strong point. The gallbladder meridian, which starts at the outer canthus of the eye and zigzags around through the temporalis and comes down to the shoulder, top of the shoulder and then front. It runs all the way down the side of the leg and out the forked toe. So it's a huge meridian, and it has 40-some points on it. And there's so much activity in the gallbladder meridian that is associated with your mind that of the 40 points, 21, this is the 21 already. That's how many points are here. So it has a lot to do, like when you are when you're going through a lot, you're trying to keep a lot together, you're thinking about a lot of things, or you're trying to make decisions and not acting on them, or you're dreading something that's coming. A lot of times the energy gets so stuck in here that this point fires up like crazy. Gallbladder 20, which we're going to do, and gallbladder 21. Now this point is stimulated with direct pressure down onto the top of the shoulder, directed towards the feet. This is also a contraindicated point in pregnancy because it sends such strong energy down, such strong, powerful energy down that it can disrupt, again, natural gestation. So stimulating this point, if you take your palms of your hands and turn them down and use your thumbs, and again, just do a basic measurement here on the highest portion, and you're just going to direct the pressure down towards the feet. And you can see by the telltale eye flutter that we're on the point. We feel like this is a good working sign. And then we're just, this is bilateral, so we're just trying the other side here. So I have the point, so again, I'm bringing attention to my own body and how I'm choosing to support my hands so I don't have to stress. So my forearms are on the table and my hands are turned like this so I can just naturally place my thumbs into the point. And my thumbs are aligned, so I'm not pressing with the pads of my thumbs so much as more the tip. And I'm just directing that pressure down. In bilateral stimulation, if you can try to focus on keeping even pressure between both contacts. So you have to just focus a little bit here to try to pick up what is even pressure. And we're going to release slowly. And where I'm at here, I'm going to come down towards the table and just a thumb with the lateral, and I'm going right above the superior angle of the scapula. Okay? And this is triple warmer 15, which is at the attachment of levator, as it attaches just above the superior angle of the scapula. So just for bony landmark's sake, you're going to take your thumbs and up again in the same position, just slide them on the table. And a lot of times you just go right into the point there a little bit. Let's see, I can feel this on this side. And then, you know, the superior angle of the scapula is a very prominent bony landmark, so you want to come just above it and press into the point. And let's see if I have it on that side. Same. So again, bilateral, direction down, directing the energy down there.
When you say down, do you mean down towards the feet?
Towards the feet, yes. Thank you. I have a tendency to hold the points around the head and neck a little longer. I mean, there's so much activity in our brain pans. You know, you want to just try to establish some sense of a still point when you're working. And trying to focus on even pressure both sides is a very nice way of doing it. And then we're just going to go into just some massage here. Just squeezing. And again, we look at the spine as a series of vertically stacked joints. So my fingers are on either side of the spine, and I'm just pressing up into the neck to help facilitate some openness in the joints. I guess facets. Right up to and under the occipital ridge. And I'm going to hook my fingers up underneath the occipital ridge and just lean back with my body weight so that they get some pretty direct digital compression into the suboccipitals and the triple worm or gallbladder points that are up underneath the occipital ridge, but also you get a little traction of the neck. And I'm just working back towards the midline. Now, on this side, I feel a little tightness. So my fingers are curled up underneath the occipital ridge, and rather than continue to press, I'm going to go into the point, and then I'm going to turn her head into the point. So I'm utilizing the weight of her head to stimulate the point. My hand is very secure, stabilized by the table, and my fingers are curling up underneath the occipital ridge. And you can hold the point a lot longer that way. If you feel on yourself, if you're not familiar with the location of gallbladder 21, they call it the wind pond because the wind gets stuck in this, and this will really help headache. So if you feel for the tip of the mastoid process, which is the bony protuberance behind your ear, if you come back about a thumb width, you'll feel this little indentation. And you tip of your finger, and then you just turn the head right into it. Very powerful, very nice, very necessary. And then you can repeat on the other side. So again, my fingers are curled up under here. I feel the mastoid process. I come back about a thumb width and curl my finger up underneath the occipital ridge, and then I'm just going to turn the head onto the fingertip. And then I'm going to come to a standing position, and this is a variation of pressing up the neck, but it's pressing up and then back, so you're creating a wave motion. So you start right at the base of the neck. And if my fingertips are on either side of the spinous process of the cervical vertebra, and I'm pushing up and bringing back, just like this.
You're totally fine. I got like that much space to see, so.
Yeah, that's a lovely move.
Turn around like that.
And then we're going to work right up to the occipital ridge, and then I'm going to come like this and bring the head motion, that chin towards the sternum. I'll do the sustained stretch. You know, we have a lot of compression at the base of our neck. A lot of times you'll see we lead with our chin for some reason, and we compress into the base here. So side flexion. So this is okay. I like this better. You can stabilize the shoulder a lot easier.
You're just holding her shoulder with your knee.
Mm-hmm. Back to neutral. That's again an advantage of having this table at this height, right? You just place the knee here, laterally flex away, stabilizing. And then we're just going to end like this. So your thigh creates this support of the lordosis of the neck, and you can just allow the neck to go back and forth and loosen the musculature there. I'll do this for a little bit. While I'm doing this, I'll ask her questions that the correct answer is all no. So, excuse me. So, and then also too, you know, you could bring it here and hook underneath the occipital ridge and stabilize and just. Okay. So here, this way, on this side, I use my thumb. Okay, let's try that.